Hi guys, this is Jason Williams, DO. This is the Williams Family Medicine channel, helping you to live your best life. Today I wanted to speak about the Women's Health Initiative study and hormone replacement therapy. Just last week, I saw a patient in the office that remarked to me about how she previously had been on hormone replacement therapy, but her physician that she was seeing at the time did not believe in hormone replacement therapy and took her off of that medication. Our opinions about treatment of women with hormone replacement therapy for menopausal symptoms is shaped by studies that we have seen and what we've been taught by those that came before us. One such study is the Women's Health Initiative. This study began in 1998 and was terminated early in 2002. This study was comprised of a randomized controlled trial, an observational study, and a behavioral arm. The intention of this study was to sort out the risk of breast cancer, colon cancer, heart disease, and osteoporosis in postmenopausal women. This study was sponsored by the NIH, the National Institutes of Health, and the National Heart, Lung, and Blood Institute. In this study, there were hormone replacement arms, there were diet arms, there were calcium and vitamin D supplementation arms. Approximately 161,000 women were enrolled, and they were aged between 50 and 79 years of age. A cohort of this study included 10,000 women who had had a hysterectomy that were treated with either estrogen or placebo. This study was terminated due to risk of stroke. A different cohort of patients in this study included about 16,000 women that were either treated with estrogen plus synthetic progestin or placebo. This study was terminated early also, but this time due to risk of breast cancer. When these results became available, this report became sensationalized. The New York Times printed a news article that stated, "Hormone replacement study, a shock to the medical system." This affected both physicians and patients. I recall when I was in training, I was taught to use hormone replacement therapy at the lowest effective dose for the least amount of time possible. This study resulted in many women stopping hormone replacement therapy if they were on it, and also prevented other women from even initiating hormone replacement therapy for fear of health risks. The issue of hormone replacement therapy is important enough to devote a whole video just to discuss this study and some of my critiques of the study. First of all, I will offer a disclaimer. I'm not an expert. I'm not a researcher. I just reviewed the study, and I have reviewed some articles, commentaries that also are from people smarter than I am that reviewed the study as well. I have compiled some of these statistics and data together to make it cohesive for myself so that I can counsel my patients better, and that's what I wanted to share with you today. My main critique of the study is that interpretation of study results was suspect. After data from the initial study was reevaluated and has been reevaluated multiple times, different conclusions of the results have been drawn. These revised conclusions have been published but have not received the same kind of media attention that the initial shock to the system article probably did. For some reason, what I'm reading suggests that deep critique of the study was not really allowed at the time of publishing. Some interesting exclusions were present. Apparently, women with significant menopausal symptoms were dissuaded from entering the study, which is interesting. Also, menopausal symptoms were not really assessed as part of the study, which is interesting. If women had known the positive benefit of treatment on some of their symptoms, they may have signed up for the study more readily or stayed in the study longer. It seemed like a large group of women were older and at high risk for the health problems that were being sampled for. Moving on, the agents used in the study are interesting. The estrogen product that was used was Premarin. Premarin, pregnant mare's urine, the estrogen that was used in the study, is not the same type of estradiol found in the body that's made by the ovaries. One would wonder that it doesn't work as well since it's not the same chemical substance or structure. Premarin was given orally. Any medication given orally often goes through processing by the liver. This increased clotting factors in the liver and could theoretically increase risk of stroke and heart attack, as well as risk of thromboembolism. Using transdermal estrogen or even pellet implanted estrogen seems to bypass this liver risk with the clotting factors. Medroxyprogesterone was the synthetic progestin used in this study. This progesterone is not the same as what is made in the body. Unfortunately, it is found to interact with estrogen receptors if in breast tissue and could increase risk for estrogen-stimulated type cancers. Medroxyprogesterone also was found to increase anxiety and aggression in mice models. It would appear that this would be a bad quality of life issue if this were occurring in women taking this medication. Next, I would like to touch on the heart disease data from the study. It was reported that patients had a 1-year increased risk in heart events when they were started on the hormone replacement arm of the study. By year 6, the number of events in the treatment group and the placebo group were about equivalent. This is in line with another study called the HERS study, HERS. This is the heart estrogen progestin replacement study. In this study, cardiac events were slightly higher in the treatment group at year 1, but at year 4, the treatment group had 42% less cardiac events than the placebo group. Another study came out in 2012. I'll read the title: Effective Hormone Replacement Therapy on Cardiovascular Events in Recently Postmenopausal Women Randomized Trial. In this study, 1,006 women were treated with either 17-beta-estradiol or 17-beta-estradiol plus norepinephrine, which is a progestin. These were women aged 45 to 58 years old and were recently menopausal. After 10 years, 16 people had cardiac events in the treatment group and 33 people had cardiac events in the placebo group. There was found to be a significant decreased risk of heart failure, all-cause mortality, and myocardial infarction. In this study, no increased risk of DVT, stroke, or breast cancer was noted. After 16 years, the protection seemed to still be present. Interestingly, the study emphasized relative risk over absolute risk. Relative risk can greatly overestimate the risk. To put this in perspective, in the estrogen plus progestin treatment arm for heart disease, they reported a relative risk of 29% cardiac events. When you actually calculate the absolute risk, it is 0.07%, not really significant. This study used unadjusted wide statistical confidence intervals. It was very common for the confidence interval to include 1, which made the study not clinically significant for that particular item that was addressed. It puzzled me to see the thromboembolism risk addressed in a 2004 paper and a 2006 paper with the same data that basically had opposite conclusions. Stroke risk also fell into the same category. The Women's Health Initiative study did have a high dropout rate, 42% in the treatment group and 38% in the placebo group. This could have significantly affected results. One of the questions I had was about the breast cancer rate increase and the concern causing halting of the study. The initial study was planned for 8 years, but was halted at the 4 to 5 year mark. I guess the question is, how long does it take to develop breast cancer? That's one question to answer. The other thought is that patients that were in the study were on the older side and are going to be higher risk for breast cancer anyway, just based on their age. 75% of cases of breast cancer occur in postmenopausal older women. In the Journal of Obstetrics and Gynecology, in an article in 2001, it reviewed about 45 studies that related to estrogen therapy and breast cancer risk. The studies that were reviewed took place between 1975 and 2000. 82% of these studies had statistics that revealed no statistical significance. In most of these studies, it was impossible to determine if there was an increased risk for breast cancer. The risk for colon cancer was decreased in the estrogen and progestin treatment arm. The study did not address the effect of estrogen on Alzheimer's disease. Alzheimer's does affect women much more than men in a ratio of about 8 to 1. Estrogen does seem to have a benefit on apoptosis, which is programmed cell death, and then also beta amyloid deposition, which is something found on autopsy in Alzheimer's disease patients. The osteoporosis aspect of the Women's Health Initiative seemed to be a little bit undervalued. The risk of an osteoporotic fracture was 3 times as likely as an MI, 6 times as likely as a stroke, and 8 times as likely as breast cancer. The morbidity and mortality of fractures in osteoporotic postmenopausal women is actually pretty high. In fact, for a hip fracture, the death rate in 1 year for postmenopausal women can be as high as 34%. Sadly, 1/2 of women who are postmenopausal will suffer an osteoporotic fracture during their lifetime. This significantly affects quality of life. It's difficult to know what would have happened had the study run longer. I read reports that the study almost became unblinded based on warnings sent out to multiple women regarding some of the early findings of increased risk of breast cancer and heart disease. It is suggested that as many as 45% of participants were unblinded to the study. An article in the Journal of American Medical Association in 2017 titled, I'll read it, Menopausal Hormone Therapy and Long-Term All-Cause Specific Mortality, the Women's Health Initiative Randomized Trials. The conclusion of the study is that in 18-year follow-up, there was no increased all-cause mortality, heart disease, or cancer risk in those treated with hormones. This is certainly a different message than what was published initially. I thought about some of the possible reasons why this study came out as it did. I wondered about the competency of the statisticians, wondered about just being ultra-conservative for some reason with the study. I also wondered about ulterior motives. It appears that the feminist movement was in phase 3 about the time the study came out. In phase 3 of the women's feminist movement, they were pushing for their rights, reproductive rights, and equality in the workplace. There were even some high-profile sexual harassment cases that occurred and gained a lot of attention in the media at that time. A hormone treatment that could greatly improve women's quality of life might be something that could be perceived as a threat by either men or women who were in opposition to the women's rights movement. I don't know if this had anything to do with the study results, the way they came out, but just made me wonder. These studies do not say that there is no risk for breast cancer, heart attack, or stroke with hormone treatment, but they also don't prove that there will be a risk. Testosterone was not addressed in this study as well, and testosterone is very beneficial for many of the menopausal symptoms that women might experience. When I think of brain health, bone health, metabolic health, relationship health, sexual function health, and overall sense of well-being, hormone replacement therapy seems like a great option for most women. I will certainly talk about theoretical risks, but my strategy would be to offer either pellet treatment, or if patients are not interested in this, then possibly topical type estrogen treatments. I hope this isn't too confusing. These are some of my thoughts about the Women's Health Initiative. I think it's important that women have an option to have treatment for their symptoms in menopause. If you're my patient, then you can use this video as information. I hope you found it useful. If you're not my patient, you need to see your own doctor to discuss your medical care. This is Jason Williams, DO. This is the Williams Family Medicine Channel, signing off.